am pleased to report today that 6,862 Albertans have recovered from COVID-19, leaving 440 active cases in the province. Currently, 31 people are hospitalized with COVID-19, with 7 of these in ICUs. In the last 24 hours, we unfortunately have confirmed 1 additional COVID-19 death in the province. This brings the total number of lives lost to 151. My condolences go out to the family and friends of this individual and all those who have lost loved ones during this time. We have now completed more than 343,000 tests. Out of 3,462 tests completed, there were 20 new cases. I know some people are wondering when we will stop identifying new cases. The reality is that the more you test, the more cases you're likely to find. It is a good thing to find cases, and Alberta continues to test more broadly than any jurisdiction in Canada. We are responding swiftly every time a new case is identified. I want to recognize the many public health professionals who continue to work around the clock to support our COVID-19 response. This weekend, as we began Stage 2, I also appreciate the efforts of Albertans who were conscientious in respecting gathering limits, maintaining a 2-meter distance, wearing masks when you couldn't, practicing good hygiene, and staying home if you were feeling sick. I know that many people were excited to visit restaurants, get their nails done, attend fitness classes or sports, and participate in worship services. And many businesses were relieved to be able to safely resume operations. As Albertans go out more, while our collective efforts can and will reduce the spread of infection, we can also expect to see some increase in cases around Alberta. To help prevent local outbreaks and help you make informed decisions, you can view a relaunch map to see where active case rates are at in different municipalities in the province. If a local municipal district has 50 active cases per 100,000 population with at least 10 active cases, we move it into the watch category. This simply means that public health will work with local public health officials and municipal officials to see if we need to implement additional measures to prevent spread. As of today, there are 2 municipal districts in this category, but no additional measures are needed at this time in either of these districts. We do continue to monitor the situation closely. It is important to remember that this threshold of 50 active cases per 100,000 population is simply one point on a spectrum of local risk. While this metric helps provide transparency to the process of determining any need for extra local measures, in areas below that threshold, we still need to continue our precautions. In Edmonton, for example, we have seen an increase in active cases over the past 2 weeks. We now have 167 active cases in this city, which is approaching the level of Calgary's 194 active cases. We must remain watchful in protecting each other. Our health system is still prepared, and our rates of hospitalization and ICU admissions for COVID-19 remain well within our capacity in Alberta. In our Edmonton cases, 2/3 of these active cases are linked to having close contact with a case of COVID-19 or being part of an outbreak. 1/3 of the active cases remain under investigation. What we know from the patterns we are seeing in the transmission is that social events where people are not keeping 2 meters distant or wearing masks are high-risk activities. We are not seeing patterns of spread at this point linked to casual contact or public places. From our weekly report on asymptomatic testing in the province, I can tell you that an additional 11,341 asymptomatic people who had no known COVID-19 exposure were tested last week as a part of our broad population monitoring goal. We identified 4 additional COVID cases in this group. I want to thank all those who have participated in this testing and encourage more people to go for testing this week. Testing broadly helps us understand where COVID may be circulating in the province. While testing is open to all Albertans, it is particularly important that anyone with symptoms or who has a known exposure to COVID-19 go for a test. In the past week, we have done 300 tests on asymptomatic close contacts of confirmed cases, with 41 new cases identified in that group. This highlights why it is so critical that close contacts of cases stay in self-isolation for 14 days, even if they are feeling well. It also underscores why we ask close contacts and anyone in an outbreak setting to be tested promptly as a part of our outbreak control measures.
Today, I'm pleased to announce that the state of public health emergency will lapse in Alberta. We've come a long way since the state of emergency was declared on March 15th. I know that these past few months have been challenging for all Albertans, families, and communities. We've all had to make sacrifices and adapt to a new normal as we work to limit the spread of COVID and keep our health system from being overwhelmed. We faced an enormous test, and our province passed with flying colors. Albertans met this challenge the same way that we meet every task. We took it seriously, and we did the right thing. And we continue to do it. As Minister of Health, I'm thankful to have had Dr. Hinshaw with us to help guide us through these extraordinary times. Declaring a public health emergency gave us tools that we needed to ensure that we could respond to the pandemic and prevent the spread of infection throughout the province. This played a small but vital role in our response over the last 3 months. For example, it provided additional authority, which helped AHS support long-term care facilities, and it provided authority to health inspectors for them to enter any area of an airport to ensure compliance with public health measures such as cleaning and physical distancing. However, due to the remarkable success of our province, the vast majority of our emergency measures were taken under the regular authority of the Public Health Act. As we entered stage 2 of the provincial relaunch, the state of emergency is no longer needed to protect Albertans. Now, I want to be clear. While the state of emergency is lapsing, it does not remove or impact the existing orders that Dr. Hinshaw has put in place, nor does it impact her ability to issue additional orders as they may be needed in the days ahead. All ministerial orders amending legislation made under Section 52.1 continue for a period of 60 days unless they are terminated sooner.